Angie Kelly Jones, a BSN student at St. Petersburg College of Nursing. This presentation is going to inform the viewers of a software application that is geared towards healthcare providers. The presented application was built by Higher Learning Technologies and is downloadable via the App Store or Google Play. The application is called ECG Mastery. The purpose of the application is to be a tool to healthcare providers who want to master the art of reading heart rhythms and why there are different heart rhythms. The goal of ECG Mastery's application is to ensure scientific knowledge is obtained through review and study. ECG Mastery was designed to be an informative tool while understanding the basic to more complex reasoning of heart rhythms. The application has many features. There are 9 categories when you first open the application. Basic is an option that includes anatomy of cardiac conduction system, cardiac action potential, and EKG tracing, and EKG lead placement. The next category is rhythm interpretation. Rhythm interpretation contains a rate calculation and how to determine the rate, as well as basic rhythm tutorial. Cardiac muscle is the next category. In this section, it teaches of the axis or view in which the EKG monitoring occurs. Hypertrophy and what an EKG will look like if a patient is diagnosed with hypertrophic cardiomyopathy. And last but not least, in this section is ischemia, injury, and infarct. Everything you need to know about how to tell where an infarct is happening by reading EKG tracing. The fourth category is conduction disturbances. In this section, the application thoroughly educates on bundle branch blocks, first-degree AV blocks, second-degree blocks, third-degree blocks, also known as complete heart block, fascicular blocks, sinus pause, and Wolff-Parkinson's White syndrome. The fifth category is on arrhythmias. They include supraventricular arrhythmia, ventricular rhythms, paced rhythms, and sick sinus syndrome. All of these, of course, have more rhythms associated within the different divisions of rhythms. In this slide, there is a poem to remember heart blocks. This poem was created by Princeton University Press, who is not affiliated with the application or Higher Learning Technologies. Moving on, the next category is a special condition selection. This selection takes you to understanding the electrolyte and drug effects that can occur on heart rhythms. They include hypokalemia, hyperkalemia, hypocalcemia, and digitalis effect. Other conditions included are hypothermia, pulmonary embolism, pericarditis, and pericardial effusion. Cardiac testing is an option which goes over all the cardiac tests available for diagnosis and treatment. They include cardiac stress test, exercise stress, cardiac stress echo, pharmacological stress test, nuclear imaging, cardiac echo, cardiac catheterization, Holter monitoring, and electrophysiologic study. The 8th category is on implanted devices, cardiac pacemaker, and implantable cardioverter defibrillators. The last category is treatment summary. This section goes over ECGs and reviews normal ECG interval and segment values. It also has an overview of ACLS guidelines, drugs, and cardioversion. This application is found to be very useful and educating. I downloaded this application for free using a free trial, then purchased the full version of this application for research and discovery. This application costs $19.99. For information obtained within this application, I feel the cost is worth it. After all, you can't put a price on a patient's life. In summary, the application's name is ECG Mastery. You can find the application at http://built-by hlt.com/medical/ECG-mastery. The application is to assist in healthcare workers' knowledge of cardiac rhythms and treatment of irregular rhythms. It has a vast variety of information as it pertains to all cardiac aspects of a patient's health. Increases scientific-based knowledge by implementing newest updated information. And this is Angie Kelly Jones, a BSN student at St. Petersburg College of Nursing. Have a good day.